So I got asthma and COPD. Asthma is a chronic lung condition that results from swelling and irritation of the airways, which causes wheezing, coughing, and shortness of breath. The airway that carries air in and out of your lungs is always a little swollen even when you're asymptomatic and are much more sensitive than normal. Asthma can be triggered by dust, pollen, and sickness such as colds. Since asthma is chronic, it means you'll have it for the rest of your life, even though you may not feel it every day. Treatment can decrease daily symptoms and can keep you from having asthma attacks. COPD, like asthma, they are very similar, is a group of lung diseases that block airflow, making it much more difficult to breathe normally. It is categorized as decreased airflow over time. It is a very common disease and is usually includes emphysema and chronic bronchitis. The damage COPD does to the lungs is irreversible and lifelong. Some symptoms include shortness of breath, wheezing, and a chronic cough. Some discussions to have with your patient prior to discharge. When to call your provider. When you're having symptoms that cannot be controlled by your inhaler or your medications, the patient's needs, what they need at home, what they need on the road, written and verbal instructions, because we all forget a little bit, and some follow-up care arrangements. Some medications listed here are used in inhalers. So the first one, short-acting beta-2 agonist, is a bronchodilator that's prescribed to treat asthma symptoms and provide quick relief. Some examples are albuterol and levoalbuterol. Short-acting muscarinic antagonists, they are just like the short-acting beta-2 agonists, but the duration is a little longer than the top one, but it does the same thing. An example is ipratropium. Then inhaled corticosteroids are taken consistently for long-term use. They're most effective for control and management of asthma. Some examples are fluticasone, budesonide, and beclomethasone. Some long-acting bronchodilators are Symbicort and formoterol, and these are for control, not for quick relief of symptoms, and they're to be used twice a day for long-term use. And then long-acting anticholinergics are mainly treat COPD. They're used as an inhaler and a nebulizer solution. They're used once daily with long-term use, and they're used as a maintenance medication. Some examples are Spiriva and tiotropium. Some lifestyle changes are learning what triggers your symptoms. Don't smoke and try to avoid secondhand smoke as much as possible. Avoid exposure to chemicals such as strong bleach, cleaning products that may irritate your nose and your throat, and aerosol hair products. Find ways to lower your stress levels, and some mild exercise is beneficial, but be careful on hot days and don't push yourself too much, and always have your rescue inhaler on you. Education to provide to your patients. Follow your provider instructions for follow-up appointments. You don't want to be missing appointments and missing tests that need to be done. Get the flu vaccine yearly. Get the pneumococcal pneumonia vaccine yearly if you're over the age of 65. You also get it under the age of 5 when you're still getting your primary vaccines. Know your medications, know what they look like, how much to take, and how often to take them. You don't want to have an asthma attack and not be able to convey, what you need. Only take your medicine exactly as a provider tells you to. Don't take more or less than, what's told. Also, wash your hands. This is a big thing. You don't want to get sick. When you get sick, then your asthma is going to flare up. Some referrals and services. You can get referred to an asthma specialist. In-home allergen assessments, they come in, they check your filters in your ducts and everything. Make sure that you're not breathing in any allergens or dust or mold or anything. Equipment repair and calibration. If you have things such as oxygen tanks and nebulizers, making sure those are completely working 100%. And then referrals for insurance, physicians and allergists, and prescription assistants. Everybody needs a little help sometimes. That's it.